The world is once again holding its breath as a new threat looms on the horizon. A deadly virus known as Marburg has emerged in Tanzania, sending shockwaves through the global health community. This outbreak marks the first of its kind in the country, casting a shadow of fear and uncertainty over the population. The streets are eerily quiet, and the usual hustle and bustle has come to a standstill. Marburg virus disease is a severe and often fatal illness, causing widespread concern among healthcare professionals. It belongs to the same family as the Ebola virus, a name that evokes memories of past outbreaks and the devastation they caused. The similarities between the two viruses are striking, both in their structure and in the fear they instill. Marburg virus is a hemorrhagic fever virus, characterized by its ability to cause severe bleeding. This means it can cause severe bleeding both internally and externally, leading to a rapid decline in health. The virus attacks multiple organ systems, leading to a cascade of devastating symptoms that can overwhelm even the strongest individuals. The speed and severity of the disease make it particularly dangerous, often leaving little time for effective treatment. Emergency medical teams are on high alert, racing against the clock to save lives. The current outbreak in Tanzania is a stark reminder of the ever-present threat of infectious diseases. It highlights the need for robust healthcare systems and rapid response mechanisms. While the world has been grappling with COVID-19, this new outbreak underscores the importance of global health security. The lessons learned from the pandemic are now being put to the test once again. We must remain vigilant and prepared to respond to emerging threats, no matter where they arise. The international community must come together, sharing resources and knowledge to combat this deadly virus and prevent future outbreaks. As of today, January 16, 2025, the Tanzanian Ministry of Health has reported 8 confirmed cases of Marburg virus disease. These cases are clustered in the northwestern region of Kagera, a rural area bordering Uganda. This region is known for its lush landscapes and close-knit communities, making the outbreak particularly devastating. The outbreak has already claimed 5 lives, a grim testament to the virus's deadly nature. Families are mourning their loved ones, and the community is gripped by fear and uncertainty. Health officials are working tirelessly to trace the contacts of those infected. This meticulous process involves mapping out the movements of each patient and identifying anyone who may have been exposed. This involves identifying anyone who may have come into contact with the virus. Community health workers are going door to door, speaking with residents, and compiling lists of potential contacts. The goal is to break the chain of transmission and prevent further spread. By isolating those who are infected and monitoring those who have been exposed, they hope to contain the outbreak. However, the remote location of the outbreak and limited resources pose significant challenges. The healthcare infrastructure in Kagera is not equipped to handle such a crisis, and medical supplies are scarce. The World Health Organization has classified the risk of this outbreak as high at the regional level. They are closely monitoring the situation and providing support to local health authorities. This is due to the potential for the virus to spread to neighboring countries with close travel and trade links to Tanzania. The porous borders and frequent movement of people and goods increase the risk of cross-border transmission. The global risk assessment is currently considered moderate. International health organizations are on high alert, ready to respond if the situation escalates further. Marburg virus disease presents with a sudden onset of symptoms, often starting with a high fever, severe headache, and muscle aches. Infected individuals may also experience nausea, vomiting, and diarrhea. These initial symptoms can easily be mistaken for other common illnesses, making early diagnosis difficult. As the disease progresses, patients may develop more severe symptoms, including jaundice, pancreatitis, and bleeding from various sites. Bleeding can occur from the nose, gums, eyes, and even internal organs. This internal bleeding is often what leads to organ failure and death. There is currently no specific treatment for Marburg virus disease. Care is primarily supportive, focusing on managing symptoms and providing fluids and electrolytes. Patients with severe cases often require intensive care, including respiratory and circulatory support. Marburg virus is transmitted to humans through contact with infected animals. Fruit bats are considered the natural reservoir of the virus, but they do not show signs of illness. Infection occurs when humans come into contact with bat droppings, saliva, or urine in caves or mines where bats roost. Once a human is infected, the virus can spread from person to person through direct contact with bodily fluids, such as blood, vomit, saliva, and urine. This transmission can occur through broken skin or mucous membranes in the eyes, nose, or mouth. Healthcare workers are at a particularly high risk of contracting the virus while caring for infected patients. It is crucial for them to wear appropriate personal protective equipment to prevent exposure. This includes gloves, gowns, masks, and eye protection. Section 5. Holding the line. The Tanzanian government, in collaboration with the WHO and other international partners, has acted swiftly to contain the outbreak. Their efforts are focused on several key areas: surveillance and contact tracing, identifying new cases quickly, and tracking down anyone who may have been exposed to the virus is paramount to stopping its spread. Isolation and treatment. Isolating infected individuals in designated healthcare facilities helps to prevent further transmission and ensures they receive appropriate care. Safe burial practices. The virus can remain infectious in deceased individuals, so it's crucial to ensure safe and dignified burials to prevent further spread. Community engagement. Educating the public about the virus, how it spreads, and how to protect themselves is essential to prevent panic and encourage cooperation with health authorities. Section 6. A wider threat? The outbreak in Tanzania has raised concerns about the potential for the virus to spread to neighboring countries. The WHO has identified several countries as being at high risk, including Uganda, Kenya, Burundi, Rwanda, and the Democratic Republic of Congo. These countries are considered high risk due to their proximity to Tanzania, the frequency of cross-border travel, and the presence of suitable bat habitats. The WHO is working closely with these countries to strengthen their preparedness and response capacities. This includes training healthcare workers, setting up surveillance systems, and stockpiling essential medical supplies. Section 7. Staying safe. While the current outbreak is localized to Tanzania, it serves as a reminder for travelers to be aware of the risks of infectious diseases. It's crucial to stay informed and take necessary precautions to protect yourself and others. Here are some precautions travelers can take to ensure their safety and well-being during their journey. Stay informed. Regularly check for travel advisories and updates from reputable sources, such as the World Health Organization, WHO, and the Centers for Disease Control and Prevention, CDC. These organizations provide the latest information on health risks and safety measures. Practice good hygiene. Wash your hands frequently with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer if soap and water are not available. This simple practice can significantly reduce the risk of infection. Avoid touching your eyes, nose, and mouth with unwashed hands. Germs can easily enter your body through these areas, so it's important to keep your hands clean and avoid unnecessary contact. Avoid contact with animals. Do not handle or approach bats or other wild animals, especially in areas where Marburg virus has been reported. Wild animals can carry diseases that are transmissible to humans, so it's best to admire them from a distance. Seek medical attention. If you develop symptoms of Marburg virus disease, such as fever, headache, or muscle aches, seek medical attention immediately. Early diagnosis and treatment are crucial for better outcomes, so don't hesitate to contact a healthcare professional if you feel unwell. Section 8. A global call to action. The Marburg virus outbreak in Tanzania is a stark reminder that infectious diseases respect no borders. It is a global challenge that requires a coordinated global response. We must strengthen global health security by investing in surveillance systems, laboratory capacity, and research and development for vaccines and treatments. We must also address the underlying factors that contribute to the emergence and spread of infectious diseases, such as poverty, deforestation, and climate change. By working together, we can create a safer and healthier world for all. Section 9. Hope on the horizon. While the current situation is concerning, there is hope on the horizon. Scientists are working tirelessly to develop vaccines and treatments for Marburg virus disease. Several promising vaccine candidates are currently in clinical trials. These vaccines use a variety of approaches to stimulate the body's immune system to fight off the virus. While the development of effective vaccines and treatments takes time, the global research community is making significant progress. In the meantime, we must remain vigilant, follow public health recommendations, and support those affected by this deadly disease.